Okay, we are going to show a technique on how to put a spacer in, or a separator in, is what we really call it in orthodontics. How a patient can do this at home if they fall out or they get chewed out or do the job and basically fall out. So I'm going to take a separator or spacer. Patient's going to take a piece of floss and they're going to put it through this side of the spacer. And they have that side of the spacer with a piece of floss. And they'll take that other piece of floss, send it through the spacer. It's like a little inner tube or donut. Now I have a piece of floss on either side, and I'm going to kind of just gently stretch the spacer out. Now we're going to take it to the patient mouth, and we're going to place it between the two teeth. Right, I want to separate between this bicuspid and this molar, and I would gently stretch it, and then I'm going to do a kind of a downward with my fingertips like that as I wiggle through, as opposed to a flat. But I'm going to do downward, and I'm just going to wiggle it back and forth until it pops through the contact. It's slowly going through. It just popped through. And then sometimes they go through too far, and you got to wiggle them back up. And once you get the spacer in place, you carefully separate the floss like that. Pull this piece out without, sometimes you have to hold the spacer down so you don't dislodge it. This one's staying in there. And then you separate this piece of floss, and again, so I don't dislodge it, I'll probably do that, hold my finger on it, and just gently pull this piece of floss out. And we have a separator in place. So that worked out really well. A patient can do that at home if they lose their spacer too early. Some people just chew through the spacer. Sometimes they're so efficient they move the teeth apart too quickly and then they just fall out. So anyway, that's a way a patient can do this at home if they need to. Thank you.